Hi there. I'm Dr. Bobby Redwood, Physician Improvement Advisor with the Superior Health Quality Alliance and past president of the Wisconsin chapter of the American College of Emergency Physicians. I'd like to thank you for taking a few minutes today to consider how you can personally help stem the tide of deaths from opioid overdoses by helping to make naloxone more accessible. As you're probably aware, ED visits for opioid overdose, hospitalizations for opioid overdose, and deaths from opioid overdose have been on the rise year after year for the past decade. 2021 was the deadliest year on record, and while there is still a delay in gathering these statistics, opioid-related deaths in 2022 are currently on track to surpass those in 2021. We should not give up hope. As a healthcare professional, caretaker, friend, or family member of someone suffering from opioid use disorder, you are in a key position to intervene and save lives. Our focus today, right now, is harm reduction by getting naloxone into the hands of those who suffer from opioid use disorder, as well as their loved ones, friends, and acquaintances who might encounter a patient or a person in an overdose scenario. Naloxone is a medication that essentially reverses the opioid overdose and brings a person who's not breathing back to life, once again breathing, so that they can go to hospital and receive definitive care. Nearly every opioid death occurs because naloxone was not available or was not administered. If we can extend the life of individuals with opioid use disorder by rescuing them from overdose, we can buy that person time to get on a medication for opioid use disorder and thus break the cycle of cravings and abuse so that he or she can engage in a comprehensive recovery program. Naloxone is to opioid overdose as EpiPen is to allergic reaction or anaphylaxis. If someone has hives from a bee sting, their doctor does not wait for them to develop severe allergic reaction before getting a 2-pack of EpiPens into their hands. As a doctor prescribing EpiPens, I always say one for your pocket, one for your purse, or one for your glove box. What's to stop us from taking the same approach with naloxone? In the Midwest, we actually have a wealth of resources to assist us in getting this life-saving medication to our patients and their families. First, in Wisconsin and Michigan, there is a standing statewide prescription for naloxone so that any patient or family member can go to any retail pharmacy and obtain naloxone without an illicit prescription from their doctor. So for those of you watching who are not prescribers or do not have a DEA number, you can recommend that your patients, friends, or family members get a naloxone kit for their home medicine cabinet from any Wisconsin or Michigan pharmacy. There's a similar law in Minnesota as long as the pharmacy is participating in the state of Minnesota's naloxone protocol. Second, did you know that the phone number 211 is a comprehensive resource for all social services, including naloxone resources for opioid use disorder? You can plug your zip code into your state's 211 website and find a number of local resources offering free naloxone, naloxone use training courses, or harm reduction resources like fentanyl test strips or needle exchange programs. Any healthcare professional, any friend or family member can inform their loved one about this key resource. Third, wouldn't it make the most sense just to hand a person with opioid use disorder a naloxone kit real time next time you see them? Of course, you can do this on an individual basis, or if you're in a healthcare setting, it only takes one clinical champion to change the culture at your hospital, clinic, or long-term care facility. The website prescribetoprevent.org has pre-written policies and protocols for naloxone discharge distribution programs. These are opportunities to buy naloxone at reduced rates, to get instructions on how to bill the medication to the next visit, so your hospital or healthcare facility isn't eating the cost. All you have to do is be a champion, visit prescribetoprevent.org, and start handing out naloxone to your overdose patients upon discharge. Finally, I would encourage each and every one of you to go to your local pharmacy and pick up some naloxone yourself. Put it in your glove box. Carry some in your work bag. You never know when a bystander, family member, or colleague will suffer from a life-threatening overdose, and you will actually be the first responder. Of course, I would never wish that scenario on anyone, but just going through the process of obtaining this life-saving antidote yourself will lower your threshold from recommending it to others. Naloxone is the EpiPen for opioid use disorder. It's time to normalize this behavior and start saving lives. What better way to reduce stigma than to walk the walk and set an example for our community?